My name is Emma, and I'm the founder of Whimble. We are a care tech platform based in Ottawa, and we exist to make personal care more accessible. So, connecting people who need short term or urgent care with experience, vetted attendance on demand. And we also work closely with event organizers and community partners to ensure any sort of accessibility strategy at a gathering includes like on demand personal care support, encouraging them to think beyond just ramps and elevators, which are obviously very important, but they're the first step in the strategy. They're not the final step. I'm really excited to chat with our guest today. We're going to try to get to the heart of why, that sounds so cheesy. We're going to get to the heart of why care matters so deeply. So yeah, welcome to Kristen. Kristen is a qualifying psychotherapist and a person with a disability whose work and lived experience sit at the intersection of mental health, identity, and care. So she's a perfect person to be having this conversation with today. She brings both clinical insight and personal perspective to a conversation that I don't feel we see happening very much, if at all, in this space. We're going to dive into how care shapes our sense of self and well-being. And I feel like it's a timely conversation because there's so much emphasis on mental health in the month of January. Kristen, thank you so much for being here today.
Thank you for having me. This is
I'm
great.
excited. I guess we could just get started by reframing how we think about care, because I think when people hear the word like personal care, activities of daily living, they think of really like the physical support, logistics, like the actual tasks involved. But from a psychological perspective, how is it also a very emotional and relational experience?
To put it broadly, everything we do as people is relational, right? But when it comes to care, you're interacting with people in a space of vulnerability. So you are letting people into your home. Often, most of the time, you're letting people into your home, you're letting them see yourself naked or in a physically compromising position. And there's a vulnerability attached to that is directly like a pipeline straight to your mental health or your mental well-being or lack thereof. So if the person that you're interacting with is not someone that cares about your well-being, or they don't have time for your well-being, or they don't have the proper training or proper tools to help you, it directly impacts how you're going to see yourself and see your day going forward. Yeah. Does that make sense?
Absolutely. And I'm scared I'm like jumping ahead too much, but with Wimble, we sometimes struggle with the fact that you can have a PSW or an attendant who technically speaking has the skills to like properly assist with lifts and transfers and assist with tasks,
Mm.
but it's not always a great fit from like a human connection perspective. So we're also trying to like better understand what are the things, what are like the data points we can use to make sure that if we're sending someone into someone's home into these like really vulnerable situations, that it's going to be a good, not just my basic physical needs got met, but also like I felt good about
The
the
care that I
experience.
got.
Yeah.
Yeah. Yeah. So I think that like you're starting at the start, which a lot of places don't get to, the start of I care about this fit, right? You're already asking this question, does this fit? Does this work for this person? Does the person that I'm sending with them have the ability to meet this person's needs? And it like just encouraging your staff and attendant care to think about client emotional well-being and just like treating, I hate that I have to say this, but treating disabled people as people is a really good place to start. Just asking that question of, is this going to be a good fit, is a question that a lot of current agencies, assisted living agencies, don't feel like they have the space to even ask, right? Where I live now, the staff are currently trained to not even ask us how we are because they believe it's not their business. So they're looking at it purely from a perspective of physical assistance. So often I will say to my attendants that I have and where I live, should I just right off the bat state
Mhm.
that I live in a assisted living facility run through a company called VHA Home Health, which they do provide 24-hour care, but it's really bare bones, absolutely bare bones care. And I feel like that's being a little bit generous. The issue is that they're actually trained to not even ask us how we are. So a lot of times the staff will come into my apartment and they're new or I don't really know them, and they'll say hi, and then I'll say, hi, how are you? And they'll say, good. And then they'll just stare at me to wait for me to direct them. And so you saying Whimble is trying to make sure there's good fit for people and that we are aware of our clients' emotional state and like where they're going to be at when they receive care is already 1,000,000% more than what's happening in a lot of other places. So I think that's great. Yeah.
I should clarify, we haven't figured it out yet, but we're trying.
I mean, the desire to figure it out, great, 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 great. 5 stars. Yeah.
Someone was mentioning the idea of like robots taking over care in a very, I think, like dystopian future. And I
Yeah.
feel like the emotional vibe you're getting from your attendants is already
It's that vibe. It's
it's
absolutely that vibe.
yeah.
Like, yeah.
So you did already mention this, but or you touched on the sometimes the attendants just don't have time or don't have time or they don't feel like they have time for like the emotional connection. So when you're in those situations where like it feels like they're rushed or it feels like what you're asking is like inconvenient, like how does that affect someone emotionally when care becomes like very transactional?
That's a really good question. I feel when care becomes transactional, there's this thing that happens where you stop being a person to the staff. You stop being someone with desires and wants and needs and like equal, for lack of a better word, equal rights, equal like rights to take up space and exist, because they start to look at you as like a series of tasks. And that dehumanization is really dangerous, because if you can do it with one person, you can do it with everyone that you're helping. And then we know what happens when people are dehumanized. I won't be political, but we're seeing that happen right now in the States with ICE, and like it results every single time in some form of violence. So that's an extreme, what I'm saying is pretty extreme, but when that happens on a smaller level where the person is forced to think about, because I'm not really pointing any blame here, but when they're forced to think about time or they're not trained to think about their impact, then you end up minimizing your needs as the client. You end up trying to think about their needs first, so that you're emotionally negotiating with them so that they can meet your physical needs, and hopefully you've calmed them down enough so they can start to see you as a person again. And while that might make you a really great therapist, it is not actually beneficial for your psychological health. It's not going to teach you, it's not going to teach your brain a sense of agency. It's not going to tell you that I deserve to take up space in the world. Over time, that'll tell you that you don't deserve to take up space in the world, and that your needs are not important, and that your needs not only are not important but come secondary, if at all, to
Mhm.
attendant care staff needs, or worst case, you don't feel like you can even ask for help. So it starts with, I'm going to ask for less, and then it turns into, can I ask for anything? And then that could very easily turn into the crisis of, I don't have the help that I need and I don't know where to get it, which is then an emergency situation in many cases. So yeah, it can be really bad.
Yeah, bad news. I don't know if anyone joined right at 12 when Chris and I were chit chatting, but you shared, you were talking about how you're using a backup extra phone because maybe you could just quickly recap that what's happened.
Yeah, I dropped my phone. I dropped my main phone that I prefer to use because I don't know, I'm uncoordinated. I dropped it and I can't pick it up right now, and no one has time to come pick it up because they're all in wake ups. So I'm just using my extra, I call it my burner phone, but it's not actually a burner. It's just a backup Apple phone that I have that is connected to my real phone, but I can't make outgoing calls really. So I have to call my friend and get my friend to call the attendants, and then they say we're busy. Like I have to FaceTime my friend, get them to get my friend to call the attendants, then they say we're busy and wake up. Hopefully I'll see my phone by 1 p.m. I don't know. Who knows? It's a good thing I don't have a day planned or anything. It's a good
Mhm.
thing I don't have a job or anything. I'm just kidding, I do, and it's not a great system.
Yeah.
Yeah,
Yeah.
yeah,
It's literally happening in your life today.
yeah, yeah.
And so I guess this leads me to my next question is to talk about like how care can be deprioritized and what we've just talked about a very real active situation of when care gets treated as optional rather than essential. But how do you see this happening on like a bigger scale?
So when care gets treated as optional on a bigger scale, it's just I cannot state enough that people stop being individuals. They not only stop being individuals with specific care and different ways that their bodies work and that their needs need to be met physically and emotionally, but they stop being people. So if you start to become a series of tasks from an emotional standpoint for the carer, the attendant, that creates a resentment, right? It creates room for these negative emotions that we see in transactional relationships like resentment, anger, a feeling of you're just here because I need a job, right? There's these very negative feelings that come up and then end up influencing the way that you do interact. Because, like I said at the beginning, even though like my attendants are encouraged not to talk to me at all, they still have to talk to me. I still have to direct my care. I will always ask them how they are. That rule is ridiculous. So what ends up happening is that even though I'm trying to be human with them, they're being encouraged not to talk to clients. So I'm getting pushback, I'm getting discomfort, right? They don't want me to ask how they are. There's a slow burn resentment, there's a discomfort, there's even a little bit of confusion. Like they are being taught not to see us as people. And that's successful. That is going to work as far as dehumanization goes. And that is really scary.
It's
Does that
scary.
answer your question?
Yeah, and then I think there's also the piece around like how who and we've talked about this in past conversations, but I'd like to explore it a bit here is like when like you mentioned, you technically, I guess on paper have access to 24/7 care,
Yeah.
but like when you look at like essential needs versus optional needs, can you clarify who's deciding where that line is between like essential and optional?
Oh, it's not me.
Okay, that's what I was hoping you were gonna
It's
say.
not me that's deciding that.
Not hoping you were gonna say, but that's what I
Yeah,
would
yeah,
think.
you knew that was coming. 'Cause, yeah, it's the managers, specifically where I am, it's the managers at VHA, but for most people that have any form of government funded care in which, like, the government decides this is how much money the organization gets, and then the organization uses the money however the fuck they want, in my personal opinion. And so it's the managers who say essential looks like you getting up and getting dressed. It doesn't look like you getting up and having a shower. It doesn't look like you getting up and looking nice. It looks like you getting up and in your chair. And that's not my decision at all. If it were up to me, I would decide that I would look nice every day. Thank you very much. Everybody went through COVID. We remember what it was like to be in our pajamas for 8 months, right? And it was not good. It's not good for your mental health. It's not good to not get to decide what you need and what is a priority for you. That is a basic part of being a human. Everybody decides ideally who they are and how they get to show up. And with disabled people, we don't get to decide that very often. And I think that's really overlooked in terms of like care and agency and the effect that has on your general psychology.
That like clinical perspective, like what is that actually doing when you're internalizing that
So
message?
it's the same thing that I was discussing before where you're learning that you don't get to have control over these things. You're learning that your needs are not important, and I want to say over time, but it's not really over time. Like you can look at it from a broader perspective of over time this erodes self-esteem, over time this causes anxiety, over time this makes you think that you're not important encourages negative self-beliefs, but it doesn't even have to exist for very long for a disabled person to think, oh fuck, what do I even do? And then that helplessness is accessing your fight or flight brain and putting you into what would then be a mental health crisis. So it doesn't have to happen very long for that to happen. Like anyone that's had mobility issues in the past but doesn't currently identify as disabled will tell you that it was really hard not knowing where to go or what to do for help or not getting my needs met. And as a disabled person, when you experience that often, it really does wreck how you see yourself, how you see your ability in the world, and how you look at the world writ large, right? Am I a person who's able to get her needs met? Am I a person that is functional and valued by society, or am I not? And over time, that does create anxiety disorders. It will create quote unquote maladaptive coping. So you might end up with like severe depression or severe anxiety or even symptoms of PTSD because you can't. All of psychology, like a little secret, all of therapy is based around giving people a sense of control back that they've lost for any multitude of reasons, right? When I do therapy with people who are disabled like me, we often are exploring that locus of control and looking at, okay, what elements of your life do you control? And often it's not care, right? They don't get to control, let's say my parents do my care, they don't get to control when that happens or how that happens because it's often on the parent's schedule or it's on the wherever they live facilities schedule, right? So over time that does create a mental health problem because it can't not, because you're being told every day your needs don't matter. And it's not like anyone's standing there and saying your needs don't matter. It's like you're actually being shown that's the way it is because you don't get to decide when your needs are met. And over time, that'll literally create disorders for you, like the ones I mentioned, anxiety disorders, OCD. Health anxiety is a huge one that I see a lot, and also just self-esteem problems generally. So difficulty viewing yourself positively and having like positive self or core beliefs. Yeah.
Yeah, it's really heavy. Is there, in terms of figuring out, is there a challenge around actually naming needs sometimes? Do you see that being a problem where someone's just so used to not having any input that they don't even know what to say they need?
Yeah. I see that all the time. That's like par for the course. I'm like, yeah, not to overgeneralize, but I'm gonna for a second. Are you a person that needs personal care? Okay, yes, you are. Okay, in my head, a light goes on. Like, we're probably gonna have to do some work around building up sense of agency where you get your needs met and where you don't, and like identifying what those needs are. Some people, it affects them so badly that they have trouble even naming or knowing their emotions and what those are because that's another thing that happens over time is like when you're dismissed so often you stop connecting with yourself because you're being told you don't matter through what's happening. So then you're like, I guess since I don't matter, I can't connect with this part of myself that feels like I do matter anymore. So you emotionally cut yourself off as a way of coping. And that's really dangerous in terms of then you're no longer able to gauge like not only what you want and need, but who you are and what you like, what you feel good about, what you feel bad about. It broadens to affect you in other ways than just like needs or non-needs. It becomes a self-identity problem at that point.
What is, I obviously it I'm assuming, not obviously, I'm assuming that it varies between individuals, but is there a generic takeaway you can give the audience of like healthy ways that people can start trying to like I don't know, reconnect themselves or whatever the therapeutic
Yeah.
term is?
Yeah, I like reconnect yourself,
It feels like
but
the robot vibes.
I think in terms of re-engaging with yourself, it's actually in psychology just called reintegration. It's not that cool. You're reintegrating different parts of yourself so that you accept them all. which is really hard to do when you've been taught to dismiss entire large parts of yourself. And as far as the ways to do that, just I'm very somatic, so I like to focus on the body. A lot of disabled people, myself included, are really disconnected from our bodies because we've been medicalized. Oh, that's a thing I didn't even talk about. So the process of medicalization, like being in the hospital a lot, having people put needles in you and do surgery on you, and since you were a kid, often causes children and people with disabilities like later grow into adults to disconnect from their bodies and to see their bodies like almost like separate, not quite separately from them, but just again, not important, right? I don't really, this is my body, but like, whatever. I'm actually a floating consciousness. So I would encourage people to reconnect with their bodies, what their bodies experience as they're talking, when they're around people that feel interesting versus when they're around people that feel upsetting, and just sitting with those feelings to start wondering about, okay, where do I feel this in my body? What is my body signaling? How is my mood different? How is the way that I'm speaking different? So you're just starting to raise that awareness a little bit in order to get engaged with that part of you that's been previously shut down. It's not really easy, and it usually goes very slowly, and it's a lot of times done with a therapist. But for anyone that doesn't have a therapist, that's the starting point, right? Wondering, getting curious about, how is my body in this moment? How is it different from other moments? And maybe even just asking yourself, what parts of myself did I have to shut down? What parts of myself have I been ignoring since I was a kid? What parts of myself are unrecognized by me? And that can really easily be identified by looking at the parts of you that often feel out of control. So if you're a person that comes into the world and they're like, I have a really bad temper, I don't know what to do about it. Sometimes when someone wrongs me, I feel like I hang on to it forever, or I don't feel like I can release my anger in a safe or useful way. They've actually already suppressed a lot of anger because there's a part of them that's probably angry that's been unrecognized since they were a child. In that scenario, for example, you would just sit with some anger, sit with it, and just let it be present in your body. Look at how anger impacts and changes the way your body feels, how it impacts and changes your thoughts, how it impacts and changes the way that your mood is expressed or not expressed. And again, that's usually done with a therapist, but you can do it by yourself. It's somatic, so all you have to do is have a body. If you have a body, you can get curious about how emotions are impacting your body and how parts of yourself are being repressed currently. Yeah, does that make sense?
Yeah, I love
Okay.
it.
Okay.
I remember being in a therapy session one time and I couldn't really understand what I was feeling. And you just made me think of this. And she's, where do you feel it? And she was like, and it was like, okay, now I can recognize like those like flight or fight, like anxiety attack, like chest gonna burst extreme like
Yeah.
feeling versus like that like gut punch to the stomach of, oh my God, I'm gonna like vomit over this terrible sad situation or something. Yeah, so it
Yeah.
is interesting how it like moves around, and obviously that'll depend on the individual and sensation and stuff, but yeah, the body,
Your
the
body will
body,
tell
what's the
you.
saying, the body holds the score, is
The
or
body
what?
keeps the score.
Yeah.
That book has actually largely been debunked, and I
Oh
have
no.
strong feelings about it.
Okay.
But the body will still tell you what's going on. Even if
Okay.
it's not keeping the score, it's still
Okay.
informative.
The body does not keep the score.
The body is informative.
Okay. Love it.
Yeah.
Okay. And then and you and I have talked about this previously as well, but it's one thing for someone to do the work, like reintegrate with themselves, like figure out what they even want or what they want to ask for. But then what happens when they've done all this work and then the system, has said, nah, that's optional or that's not essential. Like, how do you manage that?
It's a great question. You call Whimble and you
No,
say,
I
look,
didn't
the
set it up
system
for
is
that
failing
purpose.
me. No, but I've done that. I've done that. That's the truth of it, is you can be the most well-adjusted. How do you feel about swearing? Should I not swear?
Love it.
You can be the most well-adjusted fucking person on the earth, and if you're being dehumanized, if you're treated like a set of tasks, if there's no time for you, that's gonna hurt. That's gonna hurt. And your reactions that come up, how you react when you're hurt is decided when you're a kid, right? So often people will describe when people take away my needs, or when people don't pay attention or validate my needs or help me meet my needs, I feel like a little kid, or I feel out of control, or I feel like you were describing an anxious pit, or I feel an overwhelm and I'm gonna have a panic attack. Like, it's, your body is also really consistent in that way, right? So you might notice that happening. It also over time can make a person physically sick. So anyway, you didn't ask me to go into more of the problems with it. You asked me what to do about it. And I think just accepting that you're reacting like a fucking human being, right? So often we're told we're not allowed to react. We have to just accept what's given. Be grateful. As disabled people, this is especially bad. It's especially a problem that we're expected to be grateful for the care that we have. And I say, fuck that. It's okay to not be grateful. It's okay to be like, no, this is a fucking crisis that I'm in right now. I didn't get my needs met. The more that you're able to allow that reality to be there and allow yourself to contemplate that, the more that you're able to validate yourself,
Mhm.
the less that someone invalidating your reality will, or invalidating your needs and the needs of your reality will impact you. So just validating for yourself, no, I still have these needs. My needs are not shrinking. I'm not getting smaller just because this person ignored me or didn't have time for me. That's really what you can do from a psychological standpoint. And then it's really important that you look for other ways to get your needs met. So that's, I think, where Whimble comes in. That's definitely where Whimble came in for me. But yeah, yeah.
It's going back to your question about the swearing, like anytime I drop a lot of F-bombs, and anytime
Mm-hmm.
someone makes a comment on it, I'm like, how about you direct that anger towards the horribly fucking broken systems that everybody's living within,
Yeah.
not the word choices to
Yes.
manage this.
Yeah. Pay attention to the intensity and
Yeah,
why it's there, not the
yeah,
word choices. Yeah.
yeah. It's yeah. It's a different thing when your 3-year-old starts repeating it back to
Oh
you.
my
That's
God.
a whole other
That's a
issue.
whole other
Yeah,
hilarious
yeah.
problem. Yeah.
She'll have to come for therapy from you at some point. I guess and then just to, in case there's anyone on the call who happens to have control over like these broken systems, like from your perspective, what does good care infrastructure look like in practice?
Okay, no pressure, right? Okay, I think good care infrastructure actually looks like training your attendants to care. It ideally looks like paying your staff proper amounts of money, because that is, everyone's psychological health depends on how much money they have. Not fully, but like, ever want a quick pipeline to like mental health problems, it's poverty, right? So if your staff can be properly paid, I think that's the number one thing. And then also training your staff that people with disabilities are people who deserve human interactions, not transactions, and who have basic human wants and needs, and have that we're just people. I can't believe I have to say this. It's 2026, but like, I'm literally just a person that sits down. Can you help me or not? So I think those two things are really important. Paying your staff properly and training staff that like people with disabilities are humans with the same wants and needs as everybody else. It's important to not dehumanize us. It's important to not lose sight of that and to not start seeing us as a set of tasks. Because
Mhm.
you wouldn't want that for yourself. Nobody would want that for themselves. And just having training spaces where empathy is at the forefront. I hate to bring capitalism into this again, but like every everything that's like businesses that do well have empathy at the forefront, right? Like they train their people to not be transactional, and that's what we got to do. That's what you got to
Mhm.
do is open up the open things up for empathy to exist, but also encourage empathy in your training, encourage understanding of someone's situation or why their emotional well-being might not be. I don't wake up every morning I'm not like happy to enter the world. When you first wake up and you're like, oh, today fucking sucks. I'm so tired. Like, why can't I sleep for another hour? I might wake up like that because I'm a person. And if you're someone that's coming to do my care, I expect you to still understand that I'm a person, even if I can't have a full fledged, very pleasant conversation with you at 7:02 in the morning. Like, just the understanding that I will show up with different moods, just as everyone shows up to everything with different moods. Most people just don't have carers that have to see it, right? Most
Mhm.
people are able to get up and get out of bed and have their coffee before they decide whether they want to see people. Not you have a 3-year old, but is she 3? How old is your daughter?
Yeah, and I wake up with her like usually on my head, so there's no,
Oh my God.
it's okay.
She likes it. She's
Yeah,
happy about it.
yeah,
You're like, this is horrible. Yeah.
yeah. Yeah, I think one thing that people forget, and this is trying to connect some dots onto how we can improve our training as well, is we got a complaint the other day that an attendant showed up early. And we normally get the opposite, that
Yeah.
there are issues with a lot of our attendants rely on public transit or like other stuff is going on. So anyway, we're usually dealing with this person showed up 10 minutes, 15 minutes late, whatever. We got a complaint the other day that an attendant showed up an hour early,
Mm.
and which is like a little bit of extreme buffer time, even if
Yeah.
someone's trying to like account for public transit. And I think the attendant, it was a 7 a.m. shift. So they showed up at a home at 6 a.m. and knocked
Ooh.
on the door and went in. And I think maybe a bit of the disconnect or training that we can add for attendants is, yes, it's your workplace and you need to be professional and whatever, but like you are going into someone's home, into their life. Like I wouldn't want someone to show up at my house an hour early and then sit there and stare at me. So I think, yeah, that
Yeah.
just making sure they understand it's someone's life that you're walking into and you need to be respectful of that.
Yes. What you're having there is power over, right? So when we talk about empathy, we're talking about meeting someone where they're at. That's really jargony speak for like understanding yourself as an equal to the person's home that you're walking into, right? You're not just because you have keys or just because you can get into this person's home doesn't mean you should, because in that moment, whose needs are you prioritizing? You're
Mhm.
prioritizing your own needs. You're thinking about it as this is, I'm here to do my job. Maybe I want to get it done early so I can leave, and that's, I understand that need, but like you're saying, an hour is an extreme example. I think that's the opposite of empathy, and that's the opposite of understanding, and that looks at power over it instead of power with. You want to have power with the person. You want to consider the needs as well as your own. They're not
Mhm.
competing needs. They're just like you're talking about interactive. They are interdependent. So you're not, no one's holding power over someone else, which is really needs to be considered for people with disabilities because we're so used to people having power over us. And I am using the general us, but it does apply. Paratranspo, parents, family members, society not knowing what to do with us, that's all power over. And we want to try to avoid that with something as intimate as personal care needs. Yeah.
Yeah, that makes sense. The last question that I wanted to ask is really if you were able, again, follow up to my previous question about what good care infrastructure looks like, but if you're talking to policymakers or like communities, like how does treating care in the framing of a mental health essential, how does that change how we would look at policy design and community approaches to care, if that makes sense?
It does make sense, and that's a really good question. I think it changes in terms of zooming out. So when you're thinking about care as an essential for mental health, you're prioritizing a person so that they don't end up with worsening health needs,
Mhm.
worsening, we're all going to age, but ignoring care, to put it that way, to deprioritize care, is to cause disabled people to have more needs a lot sooner because we're not being humanized and we're not being recognized for our value. And over time, that erodes a person. You become sick. There's a direct link between mental well-being and like physical well-being. If you're not well mentally, you're not going to be well physically. And I think that when we're talking to policymakers, prioritizing care over years will alleviate the healthcare system, right? So if you put this at the start, if you prioritize this while you're making the policies, then you're not going to see as many disabled people needing higher levels of care. You're not going to see as many disabled people needing mental health treatment or dealing with severe mental health illnesses because they've been deprioritized for all of their life. You're going to see care that's not cause them trauma, hopefully, and then they don't need trauma treatment. So if you prioritize it at the start, you're avoiding all of those pitfalls and like traumas that cause people to need more care in the future and put more weight on the healthcare system, which is already failing. This is preventative. It's preventative care. You're taking preventative measures to ensure that people are humanized and don't have to have the trauma of needing more care, which again, there's a direct correlation. I'm not making this up. If you have trauma for your whole life, even if it's just little t trauma, we talk about big traumas, we think of sexual abuse, physical abuse, emotional abuse. And by the way, treating someone as a transaction over years and years qualifies. That's emotional trauma. So avoiding that, prioritizing care, putting it at the front of your plans causes people to flourish and to grow and allows them to be the types of people they want to be rather than the traumatized versions of themselves that end up in the hospitals or in the nursing homes or ends up alone without people, societal connection, friends, socialization. Like that's what you're avoiding. That's what you're addressing. Yeah.
Yeah, I've seen research that proves that social connection is a key indicator of like health. And I even this week I'm thinking of how many people there are in Toronto who literally can't get outside of their buildings because
Yeah.
of the snow and the fact that the sidewalks haven't been cleared yet. And to think about the fact that you're physically trapped inside and can't get out to connect with society. And then B, the person who is coming in, like that, maybe that only in-person interaction you're having for the day is treating you like a transaction. That just feels like worst possible scenario
It's
for.
absolutely like you're hurting a wound that already exists. You're aggravating it, you're making everything worse. And it really that is true. That even happens to me and I'm the friend that's, "Hey, does anyone want to hang out? I'm free." I'm not afraid to reach out to people and be a little bit quote unquote needy. But it's because I know about the effects. If you don't talk to people for a long period of time, if you don't have connections, or if your only connection is a bad one, it can be really harmful to your psychological and physical health. And that doesn't even have to exist over a long period of time. It only takes a few major bouts of loneliness for physical problems to start setting in. Yeah.
I feel like I kept trying to bring us back to positives and we kept coming back to
Oh,
negatives, but
sorry.
I know I think it's just this is an extremely fucked up situation, and I think it's hard to find a way to sugarcoat it. Any last words, Kristen, that you wanted to highlight that we haven't covered?
I think the last words are please to anyone making policies, consider care, prioritize, not just consider, but please prioritize it. And that starts with recognizing how broken it is already, right? Whimble is trying to bridge that gap, and you need to take them up on their offer.
Thank you, Kristen. I really appreciate like your openness and your insight, your honesty. It's incredibly special to talk to someone who has like the clinical training and the lived experience to be able to talk about this from both sides. So really appreciate your time.
Okay,
Thanks, Kristen.
bye.